Welcome to the Deep Dive. Today, we're tackling something pretty important, actually. It's about how these recently implemented tariffs might shake up the healthcare supply chain right here in the U.S.
Exactly. We've got some reports, some expert analysis, and they all seem to point towards, well, potential disruptions and definitely cost increases.
Right, so let's just quickly define terms. Tariffs, basically a tax on imported goods.
Yeah, that's the gist. And back on February 4th, 2025, the Trump administration put these in place. We're talking 10% on goods from China and a pretty hefty 25% on imports from Canada and Mexico.
Although, wasn't there a pause on the Canada and Mexico ones?
There was, yeah, a temporary 30-day pause. But still, think about this. Those three countries, they account for over 40% of all U.S. imports.
40%? Wow. That's a huge chunk.
It really is. And it explains why the healthcare sector is, quite concerned. The stated goals were things like boosting U.S. manufacturing, protecting jobs, and specifically targeting the flow of fentanyl.
Okay, so the sources we're looking at, published around February this year, they suggest healthcare leaders were already kind of bracing for impact.
Oh, absolutely. The preparations were already underway. The immediate worry, the one that really jumps out, is this anticipated surge in costs.
Surge.
How much are we talking?
Well, there's a survey from Black Book Market Research. It found most healthcare execs believe hospital and health system costs, they're going to swell by at least 15% in the next 6 months.
15% in 6 months. That's incredibly fast.
It is. And it's not just like the tariff costs being passed directly on. It includes things like renegotiating supplier contracts because raw materials cost more now, maybe warehousing costs if they start buying in bulk.
Right, and just general uncertainty driving prices up.
Exactly. That 15% reflects a whole bundle of knock-on effects.
Okay, digging in a bit. Pharmaceuticals seem like a particular pressure point.
Definitely. That same survey, 69% of leaders expect drug costs alone to climb by at least 10%.
10% just on pharma. And that's tied to China mostly. Largely, yes. It's about the tariffs on active pharmaceutical ingredients, APIs, the core components that often come from China.
Right. It's like, we might assemble the final pill here, but the key ingredients are imported.
Precisely. And Niobis Cuero, the CEO of the Cuero Group, he really stressed this point. He said the system's already under financial strain. So adding these tariffs, plus the sort of fuzziness around exactly how they'll be implemented day to day, it could mean delays. Delays in patients actually getting the drugs they need.
So it's not just about the money, it's about access, too,
Yeah.
which leads to the next big worry, I suppose. Actual shortages.
That's the fear, yeah. Cuero specifically mentioned that, look, a lot of our drugs and the bits needed to make them, they're made outside the U.S. Canada and China are huge players.
It makes sense from a global manufacturing perspective, but yeah, unsettling for essential things like medicine.
And that Black Book survey, again, really stark numbers. 90% of the supply chain leaders they talk to, they expect major disruptions. Yeah. Not just costs, but disruptions in, like, the basic process of getting supplies, negotiating contracts. It's a fundamental process issue.
So financial strain, logistical nightmares.
Oh, yeah.
What about, like, on the ground, in the clinic?
Good question. Dr. Amamu Tomlinson, he's the CEO of Vituity. He really highlighted that. He thinks clinical care practices themselves are going to feel this.
How so?
Well, he talked about needing to be adaptable. He used the example of a past saline shortage. Remember that?
Vaguely, yeah.
The clinicians had to, as he put it, pivot quickly to alternatives, things like lactated ringers solution.
Okay.
So we could see similar shifts now, but driven by cost or just availability because of these tariffs, not necessarily by new clinical evidence.
So doctors might have to use drug B instead of drug A simply because drug A suddenly got too expensive or hard to find?
Potentially, yes.
Yeah.
And think about that 10% tariff on APIs from China. It sounds smallish, right? But by the time that ingredient goes through manufacturing, transport, everything else, that 10% could really balloon by the time it becomes a pill for a patient.
Yeah. That's a really important point about the compounding effect. And Dr. Tomlinson also mentioned this affects billing, too.
Exactly. If you start using different treatments, different supplies, the standard billing codes might not match up perfectly. It creates, administrative headaches, more paperwork, potential reimbursement issues.
Which inevitably brings us to the impact on patients.
Right. Niobis Cuero laid it out pretty clearly. Hospitals, clinics, they face higher costs. So when they renegotiate with payers, insurance companies.
That are going to ask for more money. Makes sense.
And then what happens? The payers facing higher provider costs. They might need to increase premiums for employers.
And then employers pass that cost on to employees through their insurance contributions or higher deductibles. It's a chain reaction.
It is. And the end result, potentially, is that the average person ends up footing a good chunk of the bill for these tariffs through their healthcare costs.
So for listeners, this could mean like higher copays, higher monthly premiums.
That's the concern. Quero actually used the phrase major divide of who gets care. If costs rise significantly, it raises serious questions about affordability and access.
Wow, that's sobering. Does the data back that up?
It seems to. That Black Book survey again. 90% of hospital finance execs said they'd likely need to shift costs to payers and patients via higher charges.
90%.
And nearly 48% of the payers surveyed said they expect they'll have to raise premiums because of these supply chain cost increases.
So it really does look like the costs are expected to filter down. It paints a pretty tough picture. So given all this, what are providers actually doing? How are they preparing?
Well, they're not just sitting back. Our sources point to a few key strategies. First off, just understanding the risk.
Okay.
Yoa's Quero stressed this. Organizations need to figure out exactly which programs, which specific supplies are most vulnerable because they come from outside the U.S., like really map out their supply chains.
Bit granular, basically.
Exactly. And that requires talking internally. Quero emphasized bringing together the pharmacy teams, the finance people, and crucially, the clinicians.
Right, the doctors and nurses on the front lines.
Because they understand the dependencies in a way others might not. Quero said clinicians know the dependencies that we may not understand from the financial side.
They know how switching one type of gauze or one specific drug formulation might actually impact care in subtle ways.
Precisely. It's not just about the price tag. It's about the clinical reality.
Makes sense. What other strategies are they looking at?
Vendor diversification seems key. Dr. Tomlinson mentioned this. Hospitals, even smaller clinics, might need to actively find alternative suppliers.
Don't put all your eggs in one basket.
Pretty much. Especially for things like masks, basic medications. If your main source is now tariffed, you need backups, even if they used to be a bit more expensive. It's about resilience now.
Okay. Diversify suppliers. Anything else?
Possibly bulk purchasing. Dr. Tomlinson floated this idea, especially for supplies from Canada and Mexico, maybe trying to buy more before that 30-day pause potentially ends.
Sort of stocking up, like during COVID.
He drew that parallel, yeah. So he doesn't expect that level of crisis, but the thinking is similar. Secure inventory before prices potentially jump or supplies get tight.
So trying to get ahead of the curve on certain key items seems logical.
Definitely a proactive measure they're considering. It's all about mitigating those potential price hikes and disruptions.
So it sounds like there's a lot of planning, but also a lot of uncertainty.
That's really the bottom line from our sources. The situation is fluid, lots of moving parts. Predicting the exact long-term impact is, well, difficult. But importantly, there's also this underlying note of resilience. Both Dr. Tomlinson and Niobe Quero ended on that.
Yeah, I caught that too. Dr. Tomlinson said something like, healthcare has overcome so much, this is unlikely to be the straw that breaks the camel's back.
Right. And Quero echoed that, saying, we are not going to fall apart. There's nothing we can't do. It's a reminder that this industry does adapt. It has to.
Okay, so wrapping this up, the key takeaway seems to be this strong link between what looks like an economic policy, these tariffs, and the very real potential for impacts across the healthcare system.
Yeah. Rising costs for providers, potentially leading to higher costs for patients, the risk of shortages for critical supplies, changes in how doctors actually deliver care because of availability issues.
And ultimately, potential impacts on whether people can afford or access the care they need.
Exactly. That touches every part of the chain.
So the story's definitely still developing, but it's clear providers are already trying to get ahead of it, be proactive, be adaptable.
Which is characteristic of the sector, really.
It really makes you think, though, beyond healthcare. Given how interconnected everything is, global trade and, just daily life, what other unforeseen consequences could policies like these have?
That's a great question to ponder. How do these big economic shifts ripple outwards into other essential services, maybe in ways we haven't even considered yet? It's certainly worth thinking about how other industries might be preparing too.
Definitely something to keep an eye on. Thanks for tuning in to The Deep Dive.